Hello there, my name is Amit Pawa and thank you for joining me for this video on counting ribs using ultrasound. Now I know what you're all thinking, counting is easy, right? Well actually when we look at the anatomy of the ribs, there's a few things that we need to bear in mind to stop us from making some mistakes, and I'm going to take you through those right now. So why should we bother counting ribs? Well, the truth is that visual estimation of rib level is often incorrect. And if we can get our level where it's supposed to be, it allows us to target our anesthesia or analgesia to the area of interest and avoid those irritating missed segments. And also, it doesn't take that long. Before we get into it, I thought I'd start off with a sonoanatomy refresher. So this is the type of image you get with a paramedian sagittal scan over the ribs, and what you'll identify here is adipose tissue, the trapezius and rhomboid muscles, and we haven't seen the erector spinae muscle bulk yet because we haven't moved medially enough. You then see the shadow cast by the rib and the intercostal muscles in between them, and deep to that is the pleura. So let's apply this knowledge in clinical practice. We take a high-frequency linear probe placed laterally on the chest wall in a paramedian sagittal scan and keep sliding cephalad or cranial until we get to what we think is the top rib. This is actually rib 2. If we slide the probe towards the midline, we will see the first rib with the pleura deep to it come into view. Let's confirm that by going laterally again, and it disappears, and we'll come back towards the midline. So now we've confirmed the level of rib 1. We'll come down, get rib 2 in the middle of the screen, do the same for rib 3, and move down to rib 4, and again down to rib 5. So you can use this technique to confirm the level of the ribs that you're scanning at, and then move on to perform your regional anesthetic technique, be it an erector spinae plane block or a paravertebral block at the correct level. And finally, we've got some tips. Use a linear or a curved array probe depending on your patient's body habitus. When you start scanning, make sure you're lateral on the posterior chest wall and scanning over the ribs, not inadvertently scanning over the transverse processes. Once you reach the most cephalad rib, at that point slide medial to see the rib 1 pop into view. One note of caution at this point: if you slide your probe too cephalad and you're scanning up on the neck, it's possible that you'll identify the transverse process of C7, so make sure that you don't do that. It's important that you stabilize the probe and use slow, steady movements to make sure you count the levels correctly. And finally, to allow smooth scanning, consider using a snail trail of gel along the path the probe is going to be traveling to make that process seamless. We hope you found that video useful, and I'd like to say thank you to Dr. Shelly, Dr. Mick, Kerr and Courtney Andrews for helping in development of this video.